We're discussing the 5-year follow-up of the MANTRA trial. The trial was the first larger trial investigating or comparing catheter ablation and medical treatment as first-line treatment in patients with paroxysmal atrial fibrillation. After 2 years, that was the first analysis we did. We found that the two methods were equally good for suppressing atrial fibrillation and improving quality of life. This is a pre-planned 5-year follow-up, so that's not something we came up on the way. So that's pre-planned. All the patients were invited for a follow-up after 5 years, and now we compare the two groups. And what we find is that catheter ablation is more efficient in suppressing atrial fibrillation than is drug treatment. Likely because the way these two methods, these two treatments work on AFib are different. When we do catheter ablation, we isolate the pulmonary veins, so it's like we go towards where AFib comes from, whereas drug treatment influences the entire atrium. The drug treatment use was in the majority of patients class 1C angiorythmics, that was flecainide or propafenone. The difference is that now, after 5 years, catheter ablation was more effective than drug treatment. That was not the case within the first 2 years. What we also observed was that quality of life in these patients still was significantly better than at baseline and as good as after 2 years in both groups. So both treatments effectively or improved quality of life. It's very reassuring that only very few of these patients, around 4% altogether in the two groups, had persistent atrial fibrillation. So with this treatment where we go for sinus rhythm, for keeping sinus rhythm, that is a success measured on only very few get persistent AF. We had expected that more patients would have developed persistent AF. We're wrong, yeah, and that is pretty reassuring that it apparently it is possible. These data are some of the first data, at least the first data from a randomized controlled trial, showing that within 5 years you can keep more than 95% of the patients without persistent AF. If you compare to historical data, cohorts where you have patients with paroxysmal AF, around 4 or 5% per year progresses to persistent AF.